Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about brand image versus data when it comes to assessing healthcare quality. The star rating system has been controversial. It was originally scheduled to be released in April, and industry groups succeeded in getting it postponed until July. They questioned the methodology, saying it was overly simplistic and inaccurate. To some extent, those criticisms have merit. CMS's methodology is not perfect. There's evidence that the system could unfairly penalize teaching and safety net hospitals. But the industry's skepticism goes beyond those issues. Many of the nation's best hospitals by reputation, as rated by sources like the U.S. News & World Report, did not receive 5 stars. Out of nearly 3,700 hospitals that were rated, only about 100 earned 5 stars, and many of those are little-known hospitals. At the same time, many elite hospitals received average or even below-average ratings. So basically, the star ratings are at odds with our perceptions of hospital quality, which are largely based on brand image and reputation. This raises the question, how should we assess quality? On the basis of reputation or on the data? For finance professionals who live by data-driven decision-making, this should not be such a dilemma. No, we shouldn't disregard reputation completely, but we should be willing to question our assumptions. Keep in mind, reputation has not always been based on data in healthcare. We just haven't had solid quality data for that long. Also, healthcare leaders are susceptible to the influence of marketing and public opinion, just like everyone else. I'm saying that we shouldn't let our notions about brand image close our minds to the data. Recently, I had a chance to walk the talk with a different industry. I decided to trade in my Audi, which had developed some serious and well-documented engine problems. I was not going to buy another one of those. It was tempting to look at other luxury imports with a similar reputation, like Mercedes or BMW. Instead, I decided to rely on the published quality data and price to make the decision. And that led me to Hyundai, which is probably not a popular choice for Audi owners, but had the value I desired. Rather than looking for ways to discredit the CMS methodology, maybe we should take a deeper dive. All hospitals need to be diligent about improving quality and safety, no matter how well established their reputations may be. Multidisciplinary teams focused on quality and safety may be especially important at elite hospitals to guard against the false sense of security that a premier brand image can confer. Based on many conversations I've had over the years with physicians, I know that great quality and safety performance doesn't just happen. It takes specific and dedicated focus. And as for the metrics, it's just like financial metrics. The best way to improve them is to use them. One good thing is likely to emerge from the current debate on this issue. This data release could serve as a catalyst for developing more accurate, reliable, and consumer-friendly quality ratings. Shining a spotlight on quality ratings may be the motivation we need to make it a priority. Think about it. The data that the star ratings are based on has been available on CMS's Hospital Compare website for years. But the controversy didn't come until the data were made easy to understand by combining up to 64 measures into a single star rating. That shows the power of developing transparent, consumer-friendly information. As I've said before, we all need to make consumer-friendly information a priority, and that applies to both quality and price, the two sides of the value coin. Thanks for watching. I'll see you next month.